Hi, I'm George Russell, and I'm going to show you a few things you can do for someone who has sinus trouble, or maybe get someone to do for you if you have sinus trouble. And at the end, I'll show you some things you can do for yourself, which is usually the way I work on my own sinuses when I have a problem. So if someone has blockage and compression in their sinuses, I usually find a tight spot in their upper tract, which is this muscle right here. I just find one spot that I think is tightest, and I touch it on both sides and press straight down through their body towards their feet. And I'm just holding it. I'm not rubbing around, I'm not squeezing anything, I'm just pushing straight down and holding that spot. Maybe I'll do that for 20 or 30 seconds. Then I'm going to do the same thing all up the side of the neck. So I'm going to start at the base of the neck and just find a spot that seems tight to me. This time I'm using the tips of these fingers. My hands are against the table, and I'm just going to hold that point maybe for 15 seconds in each spot. When I find a particularly tight spot, I might stay there while I move the other hand. I'm feeling more tightness on her left, on Juno's left than on her right. I might spend 10 or 15 seconds at each spot. I'm doing a little bit faster just because I'm showing this for now. When I get up to the base of the skull, I'm just going to stop there for a minute, and I'm going to be, my fingertips are pulling back towards me on the skull, so I'm pushing the equivalent of that way, but with my middle fingers. You could stay here for, as long as you can get the person to do it for you, or but you can maybe do it for 30 seconds or something like that. The next thing I like to do is to take this corner of the base of their skull under my fingers and turn so that they're resting on my hand. Their skull is resting on my hand. I'm going to do it on this side now. Then I can follow up from the base of the spine. I just feel around very lightly on their scalp until I find little spots, little cavities. The head is full of little cavities, and they can get, little spots can get swollen or feel tender, and if you work on those, I think you'll be able to help somebody that has a sinus problem. So I'm just feeling around until I come to one that feels a little swollen to me. I feel something right here, so I'm kind of going to just rub around, sliding the skin around on the skull, and just rubbing around that point, trying to see if I can get it to let go. And then I'll move on to another spot. On Juno's head, I feel some tenderness right here, so I might hang out here longer. I'm using these fingers and this finger, but you can do it any way that's comfortable for you. Also up here I find some tenderness, so I'm just going to circle around with my thumb, just like that on the skin. You can follow that all the way up on two lines like this, over here sometimes. You can also come into the skull itself. So I like to press down with my thumbs on the bridge of the nose, so it's right here. I'm going to push straight down on the bridge of the nose with my two thumbs. I'm just moving the bridge of the nose away from her eyebrow bone. Try to stay even from side to side. I'm just making some space there. I can also come right to the inner corner of the eyebrow bone and pull slightly up. I'm kind of pressing down into her body and then also gliding up towards my waist. Another spot is the inner cheekbone here. Maybe I'll come like this. And I just push gently in. This is often, if a person has sinus problem, this will often be very tender, so you're not going to be pressing very hard, but you just hold that point. Try to be steady and just hang out. I can also just sweep across the forehead and across the eyebrow bone and across the cheekbone. That sometimes helps people too. So that's quick and dirty, my little method. If you have any questions about that, you can ask me. But if I were to do this for myself, I don't do this part when I do it for myself. I guess you could do it this way. Take your arm across the midline, hold it with the other hand. This is what's doing the work, these fingers. I'm just pressing straight down on this side. And this hurts, but I'm not showing you because I don't want you to see my weakness. But I'm pressing into that. And then I can follow up the back. I'm just stabilizing with my other hand here. Follow up the back. Just pressing into points, finding points that feel a little tender to me and holding them down, working my way up. Once I get up to here, that's not comfortable for me anymore, so I'm going to come into the base of the skull like this with my two thumbs. And then I start feeling into the cavities in my head. This cavity feels very tender to me, so I'm going to hold that for a while. And then I can find my way up. These things don't feel especially tender. But once I get to here, this is tender, and I feel it actually way forward like this. So I'll come into these points and hold them, and I'm just pushing my head against my fingers a little bit. I can follow that all the way over the top of my crown, across the side of the head, looking for those tender places and pressing into them a little bit. I could also circle around like you saw me doing with Juno. Same thing on the forehead. Then I can push down on my own nose bone. Take 2 fingers, do it this way. Just pulling my nose bone, the bridge of my nose, away from my forehead. In the inner corner of my cheekbone, like this. And also on the inner corner of my eye, I can push a little bit upwards on my forehead bone. That I can also feel through my cheekbones and underneath. And I feel like I give myself a little headache with it. You get to choose how hard you press. When you're done with that, you might feel like there's more opening in your nasal passages and it's a little bit easier for you to breathe.